Hi, welcome to the Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. Howard Shear is the founder, owner, and operator of Cambridge Recovery Sober Living. He brings considerable experience to management and operations as a results-driven finance professional. Located in northern New Jersey, Cambridge Recovery's men's-only sober homes offer residents a place to regain their independence before continuing their sober living journey on the outside. Welcome to the Addiction Recovery Place podcast, Howard. Thanks for joining us.
Thank you, Chris, for having me. It's a pleasure.
No, really appreciate your time. I know you're incredibly busy, so I really do appreciate you joining us today. We're just going to jump straight in. So tell us a little bit about yourself and your vital service in New Jersey.
Sure. Well, first I'll give you a little background on myself, how
Please.
I got into recovery.
Mhm.
I got into recovery because, I am an addict. When I was in high school, I had an injury and I broke my arm and the doctor prescribed opiates. At the time, we're talking, the early 1980s. I didn't know what opiates were. My parents didn't know what opiates were. My mother made sure I took it for 4 hours as prescribed on the bottle. I thought it was healing my bones. I had no idea what it was. But after 3 months, I was having trouble getting off of it, and I continued using for a few years thereafter. And finding sobriety at a young age is what enabled me to, go to college, graduate school, wife, kids, career, travel, all that good stuff. And had I not, found sobriety as young as I did, I would have missed out on a lot of life.
Mm-hmm. How old were you when that experience happened?
It started when I was 15.
You were 15.
And it lasted till I was about 19.
Goodness me. So when you were 19, you were able to go on to college and have a normal life while sober.
Exactly.
That's wonderful. And what did you study at university?
For undergraduate, I did accounting. And for graduate, I went to NYU for finance.
Oh, wonderful. Excellent stuff. So tell us about your service then. What are you all about, and what do you provide your residents?
Sure. We take a holistic approach to recovery.
Mm-hmm.
Let me take a step back. The majority of the people coming to our place are coming to us directly from rehab.
Mm-hmm.
That's a 30-day program. They come in and they'll test, negative for substances. And from there, we get into Aftercare mode, which is the most critical, period in recovery. It's one thing to be, sober in a locked facility. It's another thing to maintain sobriety when you're living your day-to-day life. It makes it much more challenged. But if you're in a supportive environment with other people going through the same thing, we also happen to have a full-time caseworker to help people, with treatment assessment, figuring out what they need, treatment planning, treatment referral. We help people get back to work or back to school if that's what they need, because everybody needs a reason to get out of bed in the morning. You need purpose. We want to make sure people, build a sober network of friends that they can, rely on for some support when they leave, sponsor, do home group, all that kind of stuff. There isn't just one thing to success. We also encourage people to pursue things like fitness and nutrition, faith, and meditation are all very complementary to traditional treatment.
Mm-hmm. So the main differences between rehabilitation service and services and sober living is rehabilitation services are a lot more, they're very structured. You have a lot of support. With sober living, you move along past the rehabilitation stage and you kind of regroup and rebuild your life from there. So that's what your service is all about, yeah?
Correct. Yeah. The rehab are more full or medical, they have detoxes and things like that. We don't do anything, clinical, but we do manage and quarterback their entire recovery.
Yes.
I wish I could say to people, when you come out of rehab, go to IOP, and that's what you need to do to, maintain your long-term sobriety, but it's much more complicated than that.
Mm-hmm. Of course.
And that's what we help people with.
Yeah. So you do some really important work, obviously. So tell us about the team that you have at your service.
Right now, we have a full-time caseworker, Abby. She's terrific. She's been with us for a few years now.
Mm-hmm.
She does a great job. She knows all the treatment providers in the area. So regardless of what insurance you have, she'll be able to quickly go through and figure out, who the best providers, are available and who might, be a good match for a person as well. So we're able to provide that. She's also helps with family reunification, helping people sign up for social services that they may qualify for. We want to make sure that, folks get whatever they're entitled to during this, period of transition. Um, we also, in a lot of cases, send people out for, psychological assessments. In many cases, people haven't been really assessed and have been kind of lost in the system. And what I mean by that is, one time someone may have come up with a diagnosis of depression, and they prescribed an antidepressant. There may be more complicated things than that going on, but doctors going forward tend to accept that diagnosis. Oh, he's got depression, kind of thing. But in a lot of cases, there are more things going on that could be better treated. So we like to get, a full, psychological assessment. We use Dr. Bennett over at Hackettstown, and, from there, it gives our caseworker direction on how to, plan the appropriate, course of treatment for aftercare.
So how are people referred to you? Where do you get your referrals from?
Primarily from rehabs.
From rehab, so directly from rehab.
Yes.
They leave rehabs, come straight to you.
Exactly. Their discharge planners, caseworkers, counselors recommend us, and they call us up, and we usually like to get their treatment set up before they arrive, so we'll get all their information so that they can start IOP and things like that immediately.
Okay. So, what are some of the challenges that you experience of providing your service? What are kind of the day-to-day challenges of obviously, helping people with addictions, but challenges of providing your service directly, would you say?
It's going to be challenging because I have 10 individuals, and they're all in various stages of recovery. They're not 100%. So there's always going to be that element of people not always being at their best. But I think that probably the largest challenge is the fact that addiction is a family disease, not an individual disease. And if there's, a lot of enabling going on, for instance, if someone has the option just go home and they don't want to do this anymore, they're probably not going to succeed. Addicts tend to choose the path of least resistance. And if they're given the choice to go home and to continue using, they're likely to choose that, and we're not going to get success with that. So that's, probably the biggest reason why when we fail.
So family intervention can kind of cause a lot of issues along the way for rehabilitation and sober living. I completely understand that. Do you accept residents from all across America, or is it
Yes.
New Jersey? Okay, excellent. So, how are you funded as well? How's the care funded?
It's self-pay.
Mhm.
The residents, or their families, come up with the money, each month.
Mhm.
And, insurance does not cover sober living, unfortunately. They don't consider it clinical, but, simply rent.
Right. Okay. I get it. I completely understand. Over the last 5 years, for instance, what changes or risks have you seen within drug use in your community in New Jersey? What are the things that really scare you the most with what's going on? Because there's so much.
The new stuff, it comes out so fast, we can't even keep up for it. I don't have tests for most of the new things that are out there. They're just not available commercially. One of the big things that's going on in Philadelphia is Trank, which is, mixing xylene with fentanyl. It's a deadly combination. If you happen to overdose, and you go to the hospital, Narcan may not work because Trank does not work with Narcan. It's a very dangerous combination, and it actually rots people's skin. I don't know if you've ever go onto YouTube and see the internet, but it's quite disturbing. I'm also concerned about meth use in the area increasing. I've seen that on the uptick. And synthetic drugs, all those things that people can buy on the internet or even in the local bodega or gas station. Kratom and all these other things that people buy. The fact that pot's legal now in New Jersey isn't helpful because it's everywhere.
What is legal? Sorry, I misheard that.
Marijuana.
Okay. Yep.
Yes, and being legal in New Jersey, it's everywhere.
Okay.
So that makes it, I think, more difficult for people.
So have you seen, so when New Jersey became a recreational state, so you've seen this, the use just skyrocket? Have you witnessed that? Would you say, or just obviously the availability is a lot more, but would you say it's
Right.
become more
I,
problematic?
I haven't seen a huge rush yet,
Mm.
but I do see typically, someone who's, struggling with a marijuana addiction is someone who's like, mid-30s, living in their parents' basement playing video games.
Yeah,
And that's a case where there's a lot of enabling going on too, because the parents allowed this to happen all those years.
I see.
And those are probably, those are, the marijuana addictions. Typically, I would say those folks are usually taking something else, usually prescription like an Adderall, is what I say.
So you're seeing dual use with marijuana and prescribed drugs as well. That's
Yeah. Yeah.
you,
If they can get something extra, they'll usually do that. And a lot of them prefer Adderall.
Adderall. Why Adderall?
Oh, it's a stimulant.
Hmm.
It, it gives them a euphoric effect.
Hmm.
And a lot of them are just, you know, playing video games and stuff, and they feel like it would give them, better focus.
Hmm.
I'm not, they feel better and they can,
Okay, okay, I get it.
but it's a very harmful drug, very
Absolutely.
harmful.
Absolutely. Would you say mixing alcohol with these prescribed drugs as well? I mean, that just ups the ante, doesn't it? Really on risk as well. Um,
Absolutely.
yeah. I mean, in the UK,
Just
we
heard a
yeah.
statistic
Mhm.
about Russian men. Their life expectancy is 59 years. They attributed that primarily to the fact that the alcoholism rate in Russia is just so high.
Mhm.
You know, uh, Russia, a bottle of vodka is the same price as a bottle of Pepsi. And the government makes sure that people have plenty to drink because people who are under the influence are less likely to give the government a hard time.
I see. I see. That's an
But
interesting
there's a
fact.
big problem.
Yeah.
59 years, man. We don't only have a couple of years left. I was in Russia.
That's quite a scary fact, isn't it, when you hear things
Yes.
like that? Absolutely. Absolutely. Um, I just want to come back a little bit with what you said about the nitazines and kind of when you said it's flesh eating. I mean,
Mhm.
I mean, this is something that happened over in Eastern Europe when I was in the UK. This was kind of coming onto the scene a little bit more, and now
Yeah,
it's
that was different. I think that was crocodile, I think. And that
okay.
was from like petrol, I believe.
Yeah, okay.
It was real hardcore. This is a horse tranquilizer, and they're actually getting them either through veterinarians or from the sources that veterinarians get.
So it is actually medication. So similar to ketamine kind of thing with a horse tranquilizer kind of
Yes,
that.
but not
No,
meant
no,
for humans.
no, no.
Yeah.
I totally get that. Okay, excellent. Thank you very much for explaining that to me. Um, while doing these podcasts, I've heard quite a variety of descriptions of harm reduction. And obviously, coming from the UK, we've got very different, not different, but maybe some slightly different views on harm reduction. Can you tell us your opinion on what harm reduction is and what it means?
Harm reduction is, allowing, some level of use, but in a safer way.
Mhm.
One example I would give is, Suboxone
Mm.
or methadone or any of the, various maintenance drugs, which I support fully.
Mhm.
People on Suboxone, I find, can, function at a very high level. They're functioning at a high enough level so when they go to IOP, they can get something out of the behavioral therapies. They can go back to work. They can, rebuild relationships. I was actually against it in the beginning, but I've seen it for a long time, and the people who use it responsibly do fantastic.
Mhm.
Fantastic. In terms of some of the other stuff, like, needle exchange programs and having, safe spaces for people to, use. I kind of look at Portland and, what's gone on there with that experiment. And, based on that, some of the other cities that have tried it, I think it doesn't work.
Mhm. Yeah, I see Oregon's had a real backlash against what they were trying to achieve, and it's certainly not worked. And I've obviously seen some stuff online about it, and I've got very mixed reactions around it. I mean, it should in practice work, but from what I've seen, it's a very different story, sadly. Um,
Right? The problem is they don't have enough support. Um, if they had, more counselors at these sites and they were um, holding these people more accountable to do certain things that they want to continue the privilege of coming there
mm,
and, try and move them along towards, finding sobriety.
mhm. Yeah,
But it's basically, where the masses come in, do what you want to do in a safe environment and, you know, It's safer, in case something happens, but it's not really solving the problem.
Hmm. Have you ever gone to see any of these at all in Oregon? Have you ever, you know, gone to see any of these places at all yourself?
No, no,
No.
like yourself, I've seen a lot of these stories on
Hmm.
television, and
Hmm.
it's very disappointing because initially when a lot of these places started doing it, I was optimistic
Hmm.
that it could work.
Yep, me
But
too. Yeah.
at the end of the day, when you're an addict, you're gonna take advantage of these situations if there are no, guardrails in place.
Hmm.
That's just how we are in active addiction.
Yes, most definitely, most definitely. Last couple of questions. How long do your residents normally stay with you? What's the kind of average stay, or isn't there one? It's just until they're ready
There
to.
isn't one. I'd say it's, probably, 4 to 12 months, depending on someone's situation. Sometimes, we correlate someone's discharge, or like when they're starting the new college semester.
Mm.
Sometimes people want to, kind of, hurry it up as much as possible because they want to return to the wife and kids.
Mm.
But we usually on day one set goals. It's not really a matter of time, but you want to have certain pieces in place before you leave to set you up for success.
Hmm.
As I mentioned before, you want to have all your treatment providers. You'll want to have finished your IOP. You'll want to have a sponsor doing step work, a sober network of friends, back to school, or back to work. All these things need to be in place. And I encourage a lot of people not to return home. They don't need to.
Yes.
A lot of places returning to their parents' house. They tell you right in rehab, stay away from people, places, and things associated with past use. Your home is, that place. And if it's possible, if you don't have, a wife and kids or something like that, if you're living with parents, I always, try and encourage people and even set them up with potential roommates to live with afterward in a much healthier environment. And it makes everything much, healthier for the entire family.
The services you're describing are they're very inspiring, I have to say, and I love this whole idea of very wide range of services that you provide. I mean, you deal with everything to make sure that once they leave, everyone's got the tools in their toolbox to live a sober life. Most definitely, most definitely. I think that's absolutely amazing.
Well, I actually named this place Oxford because prior to opening, the only thing that was allowed sober house that was allowed to operate in New Jersey were called Oxford houses. Oxford houses are these like self-governed houses, governed by the residents. I've probably sponsored 50 people over the years and had plenty of, folks who were staying in Oxford houses. And what I found is it just doesn't work. You have, people who are sick, not really able to look out after other people.
Mhm.
Um, Typically, these places are in bad areas where there's easy access to, drugs and alcohol. Nobody wants one of those places in their neighborhood.
Mhm.
And the houses aren't maintained. It's usually not a good situation. It's usually for people who have nowhere else to go, the Oxford houses. And I actually named my place Cambridge because I so hated the Oxford model. As you know, Cambridge and Oxford are
Of course,
rival universities. So
absolutely.
that was
Yeah,
kind of my way of showing discontent.
I love it. That's really cool. I didn't know that. No, that definitely works. So no, that's brilliant. So what are your have you got any future plans at all for Cambridge Recovery Sober Living?
Yeah,
What's
I'm
happening in
looking
the
to open
future?
up a few more houses. I'd like to open up a place in Asbury Park. I've been talking to town about doing an LGBTQ plus house. Also looking to open up another house more closer to the Morristown area.
Hmm. Big plans. So is this coming into fruition soon, or is it just in talks at the moment?
It's in talks in the moment. I'm hoping Asbury Park in the fall.
Oh wow! So very yeah. That'll come around in no time for you, I'm sure. So last question: where can people find you and your work online?
They could find me at www.cambridgerecoveryestates.com,
Mhm.
or they can call me at 908-946-0005.
Perfect. Thank you very much indeed. Last question: is there anything else that you want to mention that I may not have asked you? Is there any
Um,
message you'd like to say to anyone who's wanting to maybe go into sober living house, or it is just become
I
sober
would,
basically?
yeah, I would encourage everybody who's, going into treatment of any kind to consider sober living and to remember that, this is a lifelong disease. Um, you really need to, learn to live with it. People ask me how I've maintained my sobriety for close to 40 years. And I say it's a few reasons. There's nothing special about it. But I practice self-care. I've been being a therapist for close to 40 years. Not the same one. I've had a couple pass away. I'm so old. But, I've been going to meetings. I try and, eat right and exercise and, do the things that I'm supposed to do. And I think staying connected to the industry also keeps my disease front of mind.
Hmm.
And all those things combined, I really think are, the reasons why I've been able to maintain it. I tell people, once it's no longer front of your mind and you let your guard down, it will look for its opportunity to come back. I tell people you should be being a therapist the rest of your life. You should be going to meetings, maybe not as much in the beginning, but you should be, continuing on with that
Hmm.
and, taking care of yourself physically. And of course, if there's, you know, one of the first things we do when someone comes in is, try and make sure that if there's any type of, mental health issue, it's properly addressed. Otherwise, the propensity to self-medicate is going to continue and these efforts are futile. So we don't let anybody out of here until we got, that figured out by the best folk. Because otherwise it's just going to be, a revolving door.
Absolutely. Absolutely. Howard, thank you very much for your time today. It's been an absolute pleasure speaking to you and hearing about the amazing service you provide the residents and your community. And I wish you all the very best for the future and for your new endeavours and the new houses you're going to be opening. And maybe in 6 months' time or a year, we can have you back on so you can tell us about the other premises that you're going to be working from. So that'd be great.
Yeah, that would be great. Thank you for having me on. This was terrific. I think what you're doing is amazing. People need to, understand what this disease is about. I got to tell you, I get calls, from my website, of families, with their hair on fire, having no idea what they need to do for their loved one. And I tell them, you don't need a sober house right now. You need a rehab. I mean, the understanding is, that far. And I have to say, I faced a kind of a similar situation myself when my daughter went into depression, a few years ago. I didn't really know what to do immediately. It was before I had opened up this place.
Mm.
So I understand, that kind of panic. And, people, because of that, sometimes make bad decisions. They call the wrong number and things like that because there is a sense of urgency. But I do recommend getting a true referral and not always going to the internet
Mhm.
is probably a good idea. Those paid searches aren't always necessarily that pop up on top or aren't always the best places.
Yes, most definitely. Most definitely. Well, I'm sure they're going to remember you when they need to come onto a sober living house, that's for sure. But as I said, Howard, thank you so much for your time. It's been a real pleasure and thanks very much indeed.
Absolutely. Thanks, Chris.